Hi everyone, my name is Jonas and I'm a researcher here at NUS Healthy Longevity Translational Research Program. And welcome to our Meet Our PI series. Today we'll be speaking with Professor Vivien Wu, who is leading research in chronic disease management and also research in older adults. We'll be talking to her to discuss what it's like to be a professor here at NUS, as well as her life outside of work. Without further ado, let's go meet our PI.
We are excited for you to meet our PI, Prof. Vivien Wu.
Hi Prof. Vivien, thank you so much for joining us in our Meet Our PI series. You've been in the field for many years now. I wanted to ask you, first question is, how did your journey start in healthy longevity research?
I'm an academic and registered nurse with over 20 years of experience in both clinical and educational settings. After graduating, I worked at Neuroscience Intensive Care Unit at Singapore General Hospital. Over time, my passion for clinical education and research grew, which eventually led me to focus on research in aging population. I wanted to understand not just how to care for older adults, but how we could better support them in maintaining their independence and quality of life in the long term. This led me to shift my focus to research on aging. I realized that by contributing to research, I could develop evidence-based solutions that could improve the lives of older adults and influence healthcare practice and policies. It feels like the perfect way to combine my passion for nursing with a broader and impactful approach to addressing the needs of our aging population.
You, Prof. Vivien, you shared your journey with us on how you worked in the ICU and then slowly moving towards researching among the older population. What specifically made you research or go into the research for older people?
Early in my nursing career, I had the privilege of working closely with older adults, many of whom were facing not just physical health issues, but also emotional, cognitive, and social challenges. I remember one patient in particular, an older woman who had always been independent, but after a stroke, struggling with both her physical disabilities and the feeling of isolation. I witnessed these struggles were beyond just managing medical conditions. They were deeply tied to her sense of self and quality of life. What truly drove me towards this field was the realization that healthy aging isn't just about managing diseases, but empowering older adults to live fulfilling, independent lives.
Aging can be a very personal thing to each of us. So how has your definition of aging changed over the years? And is there a common misconception among the public regarding aging?
Along the journey, I became increasingly interested in how interventions, both medical and social, could be designed to prevent or delay frailty, enhance cognitive function, and promote overall health. One ongoing MRC-funded project is a multi-mode intervention, Care for Senior app, intensive aerobic resistance training, and brain health program, which aims to slow down frailty and cognitive decline among 500 older participants. This project further extends the benefits of e-health solutions to vulnerable older population, including lower-income seniors in Singapore. Active aging centers enroll the older adults for early interventions on exercise and brain training. This integration into routine clinical and community practice ensures sustained implementation, ongoing monitoring of the intervention, and promote continuity of care for older adults in the community. In the long term, it contributes to healthy aging, strengthens social equity, and builds a more inclusive, resilient healthcare ecosystem for Singapore's aging population.
And how often do you go to the active aging centers?
We are actually running two interventions currently. The multi-mode interventions, which I mentioned earlier, and another one is the dancing program. So we have about 6 sessions of dancing every week and 1 session of exercise program every week. Okay. So my team and me, we have been running around.
Okay, so who's the one that does this dancing? Like, who's instructing them to dance?
Okay, we actually train student dance instructors from NUS, and then we teach them how to deliver teaching to older adults to dance. So once they're ready, then we will bring them to the centers to teach a senior to dance. And our team are there to conduct an ethnographic approach on observing the interactions between the student dance instructors and the seniors.
Sometimes it's not the path that we choose,
Yeah.
but the path that we stumble on and the people we meet along the way. So do you have a person or a group that has inspired you, has helped you through your journey, especially in these past few years?
I've been fortunate to have dedicated mentors along my academic journey. Early in my career, they encouraged me to pursue healthy aging research that I was passionate about, even it was an unconventional path then. Their belief in me gave me the confidence and take on the leadership roles and explore community-based interventions. The best advice I received from them, which I now pass on to my students and junior colleagues, is to always balance rigor and empathy, conduct research that is scientifically robust, but never lose sight of the people we serve. This mindset shapes how I mentor others, reminding me that meaningful impact comes not just from findings, but from improving the lives of the communities we work with.
I think there's an angle behind a scientist or a professor that we don't really see on a daily basis. So I'm curious to know, what do you do outside of work and how do you keep yourself grounded and motivated to continue doing the work that you're doing now?
I stay grounded through my daily rituals, starting the morning with reflection and prioritization, carving out time to read and stay connected to the evidence, checking in with my students and team, and ending the day with a walk to reflect on some small wins. These simple practices keep me focused and purposeful as a scientist and educator. I usually spend my weekends with family. It's an important time for me to slow down, recharge, and stay connected with the loved ones. We enjoy simple things like sharing meals, taking walks, playing table tennis, or just being present together. Having that family time helps me to return to my work on Monday refreshed and with a clearer perspective.
Thank you, Prof. Vivien. Throughout these years, you've met many scientists as well as many research participants, and this can be regular people from the community. Is there a particular memory or a story that stands out to you throughout your years of research?
During COVID-19, when we were running our pilot dance interventions for the seniors, and everyone had to wear masks, a moment that really touched me was when an older participant made a crystal-like face mask chain for each of our team members. Yeah, it was such a thoughtful, gentle gesture, and it reminded me that of trust, care, and human connection that make our research meaningful. Moments like this continue to inspire me to carry on our important work.
Thank you for taking the time to talk with us today, Prof. Vivien. Alright, so here we are at MD6 Level 5 Alice Lee Centre for Nursing Studies at NUS, and we just finished speaking with Prof. Vivien and her team. And the studies that they are doing are many, and some of them are just beginning. If you're interested to learn more about the studies being conducted here, please click the link below or scan the QR code. Until then, thank you so much for joining me on this Meet Our PI series. And on behalf of me and Neddy, we'll see you on the next one.